everyone, and thank you for joining us. I'm Julie D. Simone. I'm the Program Officer of the Mayor's Wellness Campaign in the New Jersey Healthcare Quality Institute. Before we get started, just to go over a couple of housekeeping items, all of the phone lines will be muted for the duration of the program to limit background noise. The webinar is being recorded and we'll post it up on our website after the presentation. And you can ask questions for our speakers by typing them into the chat box, and we're going to address them at the end of the presentation. So feel free to type those in throughout. The Quality Institute is a multi-stakeholder membership organization that convenes healthcare leaders in New Jersey around the common goal of improving the safety, quality, and affordability of healthcare for everyone. The Mayor's Wellness Campaign is our community health initiative in partnership with the New Jersey State League of Municipalities. And the Mayor's Wellness Campaign provides mayors and their teams with evidence-based tools and strategies to improve the health and wellness of their communities. And this year, we're excited to be celebrating our 15th anniversary. Over the last 15 years, the Mayor's Wellness Campaign has grown to include over 400 municipalities throughout the state. And today we're partnering with the Community Food Bank of New Jersey. One of the many impacts of the pandemic on our residents has been an increase in food insecurity throughout the state. We're going to hear from Triada Stampis and Jessica Ellison from the Community Food Bank about the work they've been doing to support New Jersey residents throughout the pandemic. We're also going to hear from Stacey Flanagan from Jersey City on how Jersey City's Mayor's Wellness Campaign partnered with the Community Food Bank at the local level. So now I'm going to turn it over to Triada Stampis.
Thank you, Julie, and thanks everybody for spending part of your afternoon with us. I am the impact leader at the Community Food Bank of New Jersey. If you could advance to the next slide. This is our mission statement. We fight hunger and poverty in New Jersey by assisting those in need and seeking long-term solutions. We engage, educate, and empower all sectors of society in the battle. Our tagline is we fill the emptiness caused by hunger with food, help, and hope. You'll notice that there is nothing in the mission statement that says we deliver food. We know that the answer to food insecurity is more than just the meal that somebody might need to, tonight, or food at home for tomorrow. And so we really are called to a broader anti-hunger mission. Next slide. So we directly serve 15 of New Jersey's 21 counties. In this little mini map that you see here, you see our sister food banks in the state. That includes Fulfill, the Food Bank of South Jersey, but also we have partner distribution organizations in 4 of our 15 counties, Mercer Street Friends in Mercer County and Norwest Cap in northwestern New Jersey. We've been around for over 45 years. We are a member of Feeding America, which is the country's national umbrella organization for the 200 food banks, regional food banks that serve the totality of the United States and Puerto Rico. Next slide. So we're talking here today to talk about food insecurity. As of 2020, so that's what these numbers are, more than 54 million people in the United States are estimated to be food insecure, including over 18 million children. The numbers in New Jersey, if we go to the next slide, include 1.2 million New Jersey residents who are food insecure. Of those 1.2 million, 400,000 are children. One of the things we know about food insecurity is that children are disproportionately impacted. The bottom 2 slides are actually pre-pandemic numbers. We don't have a good read on how the pandemic has impacted these particular populations, but prior to the pandemic, 100,000 seniors in New Jersey were food insecure, and 50,000 community college students. So what you see here is that there is no stage of life where that food insecurity doesn't touch. And you'll see as we go through the slides that there's also no part of our state that food insecurity doesn't touch. Next slide. So what does it mean to be food insecure? Just want to kind of level set here and make sure that we are all talking about the same thing. Food insecurity is the lack of consistent access to adequate food to sustain an active, healthy life. And those, the words that are underlined for a reason. Those are some key concepts. Consistency, is something that's needed to be food secure. Adequacy, obviously, having enough food. And then it's the right food. It's food to sustain an active, healthy life. So it's not just any food. It's not just calories to sustain survival. You're not food secure until you have the food that can promote your health and wellness. Food insecurity can be episodic or chronic. So it can happen when there's an emergency or some misfortune befalls a person, but it can also be a chronic state. And that's something that we see in particular with low wage workers who don't earn enough in our high cost of living state to afford to put good food on the table. Food insecurity can show up as skimping in both the quality and the quantity of food, either one. So not having the right food or the best food is a form of food insecurity, especially if those choices are being made because of a lack of adequate resources. And it also can show up as not enough food, as skimping. And what we know anecdotally, but what we also see reflected in the research is that it can be experienced by some household members, but not others. And the kind of classic example of this is households with children. Very often, the adults will sacrifice food so that the children don't have to, so that children are adequately fed. And so the children may be food secure in that same household, but the adults are food insecure. And then important to point out, because I know we all have, kind of images in our head or stereotypical images in our head of what is a food insecure person. Certainly it exists among people who have no income, but also among working people who just aren't earning enough. Next slide. So the experience of food insecurity varies. What you have here in this upside down triangle is the 4 different food security categories that the USDA uses. The USDA is the agency that measures food insecurity across the country. And there is an 18-question survey that gets administered by the US Census Bureau every December that asks a set of questions that relate to a person's food security status. So the number of questions that are answered yes put people somewhere on this scale. And the top 2 sections of the triangle, high food security and marginal food security, are considered food secure. Although marginal is, close to the edge, right above the threshold. But then below, the 2 sections below are what we are talking about when we talk about food insecurity. And those are 2 different categories. Low food security is characterized by reduced quality, variety, or desirability of food. Like I was saying, if a poor diet is the result of a lack of adequate resources for food, that is a form of low food security. Very low food security is skipping meals, reducing quantities of food, disrupting eating patterns because of just a sheer insufficiency of enough food and no resources to get more. So there's a severity that can vary even when we're talking about food insecure people. There is no one food insecure person. There is no one experience of food insecurity. It can really vary. Next slide. And the ripple effects across a person's life and a community life are pretty far reaching. Hunger, food insecurity impacts social, behavioral, and emotional wellness. It impacts stress response. It impacts the ability to learn and focus in school, preparedness for the workforce, child development, chronic disease, predisposition, as well as community well-being as measured by the productivity of its members. One of the things that we talk about at our food bank is really about how hunger really kind of limits opportunities. And a really good recent example of that was research that came out a couple of months ago about the timing of SAT tests relative to when it's SNAP benefits, and we'll get into SNAP a little bit more, but as you may know, SNAP, the Supplemental Nutrition Assistance Program, still sometimes known as food stamps, are monthly benefits that are issued in New Jersey at the top of the month. In different states, they do it different ways, but it's once a month. And it's dedicated money to buy groceries and for low-income families. And so this study found that when the SAT was issued around the time that SNAP benefits are dispersed in a particular state, low-income students' test scores tend to go up and tend to be higher than when the SAT is administered in the last 2 weeks of that benefit cycle, that monthly benefit cycle. The SAT scores tend to be lower, and college admissions, four-year college admissions tend to be lowered. So at a time of the month when a household might not have as many resources for food, if a high school student takes the SAT, there's less likelihood that they'll get admitted into a four-year college. And so that's a real concrete example of, how hunger can really limit opportunities and have impact well beyond, a grumbling tummy that day. Next slide. So COVID-19, we know, has had a really strong and immediate impact on our economy. And so it's also been reflected in food insecurity. New Jersey in 2020 is estimated to have a 56% increase in food insecurity. That's a higher percentage increase than our neighboring states or the country as a whole. We know there are a number of reasons for this. There were a lot of people kind of living in that marginal food security category before the pandemic hit, and so they were right on the edge. We know that we have many communities that were hit especially hard because of local economies. I think about Atlantic City, for example, and that entire regional economy kind of anchored around the hospitality industry there really hit hard. So we have had a disproportionate impact of COVID-19 on food insecurity here in New Jersey. Next slide. And if you look at the map by county, there is no part of the state that hasn't been affected by this. On the left, you see pre-COVID food insecurity rates, and on the right, the 2020 estimates of food insecurity. Every single county has gotten a shade darker or 2 shades darker on the map when you do that side-by-side comparison. Next slide. An important lesson for us is what happened after the last recession. It wasn't, it was only about a little over a decade ago that we last experienced a major economic downturn. And what we saw happen then was that it took about 2 years for food insecurity rates to peak when the recession hit, but then it took almost 10 years for food insecurity to drop back to pre-recession levels, both in our state and in the nation, in the nation overall. We tend to track, New Jersey tends to track just a little under. We are, generally speaking, a fairly affluent state, although I think we all know that that's not everybody. But the lesson here for us is that the food security crisis could well outlast the public health and economic crisis, because that's what happened 10 years ago. Next slide. So where do food banks fit into the picture? Like I said, our mission statement is not about food delivery. And we know that that's not the totality of the solution. Emergency food is one resource, but not the only resource that food insecure households rely on for food. And there's almost a hierarchy. More than half of food insecure individuals are earning over the poverty line. So, first it's about, is there income to buy food? There's also public benefits, and these are pre-pandemic numbers for SNAP, for WIC, for school meals, but I just put them there to show you the scale of these public anti-hunger resources and these safety net supports that guard against hunger. These are all federal programs, but almost, nearly $1.5 billion in SNAP benefits come into New Jersey in a given year. Those numbers are now higher because more people have been enrolling in SNAP as they've lost their jobs. WIC provides, $84 million, or was providing $84 million in annual benefits. The school meal programs with COVID have been obviously seriously disrupted, but prior to the pandemic, 115 million meals served over the state. So there are significant resources that these safety net programs provide. And then there's also family and community supports. People lean on family and friends and on that generosity until they can't anymore. So emergency food, and what I mean when I talk about emergency food is a food pantry or a soup kitchen or some other community food distribution program that really ends up being the last line of defense. That is, when there's no money in your wallet, your benefits have run out, and you've exhausted the generosity of friends and family, you can stand on a pantry line, or you can go to a soup kitchen for a hot meal, although that's been disrupted by the pandemic as well. These, congregate meal environments are not right now operating the way that they were before the pandemic for safety and health reasons. Next slide. So our approach is as expansive as the set of resources that food insecure people rely on. And so here I'm going to turn it over to my colleague, Jessica Ellison, to talk through how we at the Community Food Bank of New Jersey approach fighting hunger and how we partner in that with other stakeholders.
All right, thank you so much, Triada. And again, in talking about food insecurity as well as hunger and how we address these different issues, there are several ways that Community Food Bank of New Jersey does this. One, we look at focusing on feeding the line efforts. And when we do this, we look at providing nutrition foods and meals for today. And we do that by servicing a lot of our senior sites as well as our child-based sites. About half of our food is donated and the rest is purchased by government. And so we try to distribute those foods as many ways as we can to as many sites as possible. But in addition to that, we also look at health and wellness efforts. So this is providing health education. So we're teaching people about resource management. We're teaching individuals about how exactly to be able to make those food dollars stretch. How do you prepare healthy meals for your family so that way that it's not contributing to chronic disease? Because a lot of times what we see at these, when we're talking about food distribution and servicing the community is that we're finding that some of the food that is being served is not always in alignment with health and wellness. And so, we're having people with chronic diseases coming to these lines, being fed food that's only supporting some of those chronic diseases. And so we want to be able to really look at health education, and we want to talk about creating awareness and talking about how all of that improves and helps to fight food insecurity. And so in that, we look at providing and distributing boxes of foods that have fresh produce, lean proteins. We talk more about whole grains. And then we also have disease-specific food boxes that we distribute at some of our sites to help with, again, combating the chronic conditions such as diabetes, high blood pressure, and those types of conditions. And then healthy eating education classes through our SNAP-Ed program, which I'll talk a little bit more in detail about. And then we look at our shorten the line efforts, which really looks at working towards lasting changes. So this is about being able to help our struggling neighbors with getting on SNAP, is formerly known as food stamps. So being able to receive those food dollars, being able to be engaged in job training opportunities, so that way that they can be able to feel that they can be able to get a job and get these resources to their own families, so that way that they're feeding their families, and restoring that dignity in all of this work as well. Also providing additional resources that are essential to help people sustain their living. And we also work with local and state governments on longer term solutions, which we will talk about because that's the reason why a lot of you are here today, is to really help to look at those long-term solutions. And also we are involved in engaging all sectors of society. So we're not just about working with just the food pantries, the faith-based sites, but we're also out there working with government partners. We're there working with corporate partners, being able to raise awareness, working with the general public. We've actually been able to engage a lot of our volunteers. We have a lot of corporate volunteers, school-based volunteers that come in so they can see the work that they're doing, actually put their hands and getting their hands involved in what we're doing, so that way they understand the purpose and why it's so important for us to be able to continue this work. And so these are all the ways in which we engage the community and the general public and being able to help to fight hunger. But then these are specifically just our approaches. And I'm going to delve a little bit deeper into some of these concepts. Next slide. So at a glance, we provide food for over 84 million meals annually throughout New Jersey. And not only that, but we address hunger as a health issue by delivering more than 20 million pounds of produce each year. So that we're providing that fresh foods to our neighbors and to our community. We've provided essential job skills to more than 2,500 FSTA students, and I'll talk about our food service training academy and a little bit more detail too throughout this presentation. So that way that for those who are seeking a second chance at a career, an opportunity just to be able to provide food and put food on the table for their families. We source and distribute 3 nutritional meals for every $1 donated. We enable the work of 1,000 partners who feed those in need in our communities. And our volunteers dedicate 79,000 hours of their time every year towards fighting hunger. Next slide. So these are just some of the things that we do. And in really looking at hunger as a health issue, we know that delivering food is crucial to our mission. But it's not just delivering any type of food. It's about delivering food that is healthy and can help to support positive lifestyle changes for our neighbors. And some of the ways that we do that is through our Healthy Families Farmers Markets, where we distribute free, fresh produce year-round to struggling New Jerseyans who couldn't otherwise afford it. And a lot of times with that too, we're partnering that with nutrition education. We're partnering that with nutritional handouts as well as recipes, so that way that our community members know how to be able to utilize some of these fresh produce, because we do have had that shared as well, where we might give away some of these fresh produce and people may not know how to prepare it, and so that's the reason why our nutrition education portion, which I'll talk about a little bit, is so important and key to this. In addition to that, we have our diabetes initiative, again, providing that health screenings, diabetes friendly foods and nutrition education to diabetic and pre-diabetic people. But though that is more of the larger community, we also provide it to those who are suffering from obesity, those who have high blood pressure, and other chronic diseases as well. So it's not just for the diabetes partners and participants in the community, but it's also open up to the more general public as well. And these program participants are provided with shelf-stable food boxes, as well as fresh produce on a bi-weekly basis. And when we talk about shelf-stable, we're talking about whole grains items, as well as low-fat dairy and low-sodium products. And so with that, we partner with the Summit Medical Group Foundation. So these are some of the ways in which we've been able to work with some of our healthcare sites and being able to have them providing some of the health education that focuses on diabetes management for this program. And so that our clients understand how to control their blood pressure, glucose levels, how stress and illness affects the blood sugar, as well as how to prevent and reduce diabetes complications. So we're not just providing just the food, but we're also providing the education specifically about some of these topics as well. In addition to talking about just the diabetes, continuing to talk about the diabetes program and boxes that we give, we also work with the sites to be able to focus on healthy lifestyle. So we do have physical activity education that's also provided by our nutrition education team. And in that, we provide 3 screenings to our program participants and quarterly meetings and screenings to be able to track their A1C. So that way that we can be able to see, is there any progression, that's any improvement that's being made to the program. And we look at A1C, we look at blood pressure, and we also look at weight. As I said, the program is looking at all of these key components and people who are affected by these as well. And recently, we've been able to offer these programs COVID-19 screenings also for our pantry clients, but that's provided more so by our partner, Summit Medical Group Foundation. Okay. And so in all of our participants that were either pre-diabetic 55% or diabetic 45% at the start of the program, we noticed that a majority, we had 60% of the participants in this program who were obese, and people who were hypertensive either at stage 1 or stage 2. And we saw that 95% of our program participants reported that through engaging in our work, that they've been in the food boxes, nutrition education, and the screenings, all of those things, 95% of our program participants have reported changing their behaviors, either eating healthier or being more active. So it just shows you the impact of the work that we do. Next slide. So this is just a program participants and how, for her, the impact it was able to make. Next slide. We have our child nutrition program. So our child nutrition program is specifically invested in providing food and service to our child-based food sites. So this is any sites in which serves children. So it can be at any facility, it can be at a school, it can be at camps programming. Our goal is to be able to provide food for our children because we know that our children are very vulnerable. And a lot of times, as you can see from the numbers that were shared in the very beginning of the program, we have so many of our children that are in need and hungry throughout the state. And that affects their ability to be able to be productive in their classes, being able to be productive and growth as individuals who are supposed to be our future. And so we want to be able to make sure that we're making an impact there. And we serve the students in 3 different ways. Through our Kids Cafe program, which provides meals every day, every weekday after school, so that our students don't go hungry go home on an empty stomach. We provide our family pack programs to help sustain families throughout the weekend, so that our students throughout the week, they don't lose access to food throughout the weekend and also during the holidays as well. Oftentimes we're not thinking about how when we have these days off, that can be a meal being missed for a child. And so that's the reason why we provide our family pack program, so that we work with the sites to be able to identify children who are in need, or they notice that there may be some food insecurity issues taking place. And what we do is we enroll the schools in the sites to be able to go through a training program, and from being trained are able to designate a certain site person to help distribute some of those bags of foods to those sites. And we do that very in a way that doesn't shame the child or anything that sort. We do it very discreetly, so that way that, again, that child is able to take food home to be able to feed at least a family of 4. And we then have our summer nutrition program, which helps to bridge the gap that kids face in the summertime when they may not be able to get access to free school meals. And so when we're talking about those months off, we want to be able to make sure that we're meeting those gaps. So our goals, our program is really designed to meet all of the gap times and to meet all of the needs of when children will be able to need food. And so whether it be in school, whether it be in the weekends, during holidays, and also during that summertime when we have time off. Next slide. And this is one of our fellow recipients who has been able to benefit from our program. And again, just some of the smiles we've been able to create as a result of this. Next slide. So we have also, in addition to having our kids feeding program, we also have a senior feeding program, because we know that oftentimes our seniors are on a fixed income. And a lot of times halfway throughout the month, a lot of our seniors are finding themselves having to make really hard decisions between whether or not they should get food or be able to support purchasing their medicines. And we know that we don't want to have people having to make some of those tough decisions. So that's the reason why we provide food to our senior sites. And the way in which we do that is providing senior food boxes, which contain items like shelf-stable milk, canned protein items. And in addition to that, we also do community distributions where we actually go out to senior housing sites and senior centers, and we actually distribute these boxes where they get to come out. We set up our trucks and our table, and we actually have our seniors come up and we actually give them food boxes to take with them home. And so we're part of a statewide reach when it comes to this program, and we coordinate with the state to provide this service. So if you know that you have any senior housing sites or senior centers that would be interested in receiving some of these services, please let us know, because we would be glad to be able to connect you and to get your senior sites with these food boxes. Next slide. And this is, again, one of our other recipients of this great program and the impact that it was able to make on her life. Next slide. In addition to providing food and resources, we also know that people are making hard decisions when it comes to just supporting life-based items, such as hygiene supplies. And some of these hygiene supplies, to maybe the person who's able to afford it may not seem as much, but to a person who is food insecure or coming from very low income backgrounds, making the decision as to whether or not they purchase an item that is a hygienic item versus being able to support food can be a really hard and tough decision. And so we help to alleviate some of that by providing, again, hygiene products such as our diaper program. And our diaper program provides parents with diapers each month to help keep their babies clean and dry and healthy. And again, we understand how diapers can become very expensive. And for the amount of times that people are changing diapers every day on a child, you can imagine how hard it is for those who can't afford it. The decisions they have to make, and maybe, how they are able to gain access to this. And that's the reason why we have our diaper program. And our diaper program is a statewide program. And we work with our sister food banks to ensure that the entire state has access. So, and this is one example of some county-based partnerships that we've been able to create, is that in Bergen County, to ensure that we've been able to ensure that their pantries are able to provide diapers for the next 6 months to all participants that come in to receive them. So these are the types of partnerships and programming that we try to do, not only just on a local level, not just on the level of just organizations, but we are talking about just on a county. How do we engage our counties to be able to meet some of these needs of their participants and their residents? We also have the Period Initiative, which provides free period products every month to menstruating individuals who can't access them. And so we work with a lot of our different pantries. We work with a lot of our different sites to be able to provide these gifts to the community. Next slide. And this is one of our fellow recipients of our Period program. And again, talking about how expensive it can be and the impact it was able to really make on her life. All right, next slide. Really quickly, I'm going to talk about our Food Service Training Academy, just to talk about just some of the resources, additional resources that we provide in-house. So this program is really based out of our Hillside site. Actually, one of the very proud moments for us is that our Food Service Training Academy was actually officially recognized as a New Jersey training school. And so part of this work that we do is provide three main things: culinary training, employment assistance, and hands-on experience. So the culinary training is that we are able to teach our participants to be able to prepare healthy meals for their community, and to be able to go out into the world to be able to get jobs that are culinary based. In addition to that, we provide employment assistance. So we help prepare the students for the workforce, and also help them to gain internships and jobs after graduation. We see a high, like I said, 90% of our students employed within a month of graduating. And that just shows the force and the tenacity of our team and really getting those who are going through this program to get assistance. And we provide hands-on experience, which is, again, getting the students to be able to know how to work within a commercial kitchen, how to set up catering, how to do set up catering setups. And again, a lot of our students actually come out developing their own job, coming up and becoming entrepreneurs, developing their own programs, or working with a lot of our other sites. Next slide. And this is one of our fellow students who was, again, a recipient of the program. The next slide. We have our resource access team. So we talked about SNAP before. And again, we know that SNAP is a frontline defense against hunger. But a lot of times there's a huge gap between those who are on SNAP and those who are SNAP eligible. And we see that there's a lot more SNAP eligible participants that are not engaging, rather than that sometimes they don't know that they're eligible, sometimes they just don't know how to fill out the application or know how to engage in it, or maybe they've had some trouble in the past and may not feel that they may not be eligible this time around. And that's the reason why our SNAP outreach work is so important, because we have our team to go out and to provide pre-screenings and application assistance to the community. And not only are we providing just SNAP assistance, we're also providing assistance with LAHEAP, which is more of our energy program, which helps to provide assistance with heating costs, electric, natural gas, oil, and all other deliverable fuels. And this helps to be able to provide screenings, again, and application assistance to those eligible as well. And we're also on the grounds always with providing advocacy work. So being able to not only expand access to SNAP, but also sharing more about our food programs, such as our senior programs and benefits that they can get, as well as, of course, we've been pushing the PEBT throughout this time as well. So it's just been creating more awareness and getting people to understand the importance of these assistance programs and being able to help meet some of those gaps. Next slide. And we provide a variety of assistance to Atlantic, Cumberland, Essex, Hudson, Middlesex, Morris, Passaic, Somerset, and Union. We have a multilingual team. And again, we're providing assistance only for LAHEAP services, mostly in Bergen and Cape May. But again, if there's one of the things about the work that we do is, again, we work with sister programs and programs throughout the state that if they say that maybe there's listed here, there's a county that CFB&J doesn't cover, we can connect you to other SNAP and SNAP Ed grantees throughout the state who can cover your counties. Next slide. And then speaking about SNAP Ed, so our SNAP Ed is our education program. So people often say SNAP is SNAP as if they're SNAP Ed is they're the same thing, but it isn't. SNAP Ed is more of the education portion of it. So we provide the education that helps to back the foods and the items that are being received. And so with the SNAP Ed education, there's two ways in which we provide education. One is direct education, which is the direct sitting in the classroom, and then not classroom, but more of that direct nutrition education piece. And then the other one is policy systems and environmental changes. Because there's one thing if we're providing nutrition education to you, right? You go out into the world and you're going back to those same environments that may not provide those healthy food options. And now you're being provided with this education that now tells you and now you feel inspired to make healthy changes, but there's nothing around you that supports the ability to do that. And so one of the ways that we do is we work with sites and centers and organizations to help develop policies and create environmental changes, as well as being able to develop systems that support health and wellness. So that way that when you're going to that corner store, if the corner store is where you shop, that you can go into that corner store, and we actually help to convert corner stores to being healthy corner stores where they can provide healthier food options within those corner stores at a priceable level, at a level that people can afford. We work with the schools to be able to develop community gardens, after school programs, different things that sort of help to reinforce some of these messages. We work with faith-based sites to be able to develop walking trails, monthly activities that help to engage the participants in being able to be more physically active and knowing how to make the healthiest choice, the easiest choice for them. And so there's a lot of different ways in which we engage the sites in these types of programming. But again, our goal is really to just get people more active and again, make the healthy choice the easy choice. And next slide. And I think I'm a little over on time, so I'm gonna move a little quicker to my presentation. We cover counties Atlantic, Cumberland, Salem, Cape May, Essex, Bergen, Hudson, Passaic, Middlesex, Union, Monmouth, Ocean. And again, same thing applies here, is that CFB&J is just one of the grantees. We do have other grantees throughout the state of the SNAP-Ed grant. And if there is any, if let's say we're not covering any of your counties, we would be more than happy to be able to transition and to be able to connect you to our other grantees so you can be able to get coverage for your SNAP-Ed programming. But again, we have a multilingual team, team. We have live cooking demonstrations that we provide. We bring all the food and all of the resources to the site itself, and we engage the participant there. So really, the site really just has to provide the space and the people, and our goal is to really engage our participants. And so many people have talked so well about these programs, from children to seniors to adults to so many different groups that have been able to really be engaged to our programming. And we serve children, adults, and our general community. Next slide. And so, as I said, we serve our children through a variety of different services. But one thing people don't really realize that we do is actually we specifically work with other program groups as well, such as new and pregnant moms. We do have new and pregnant mom programs that teach our children how to feed their children solid food, how to feed their babies, how to be more active while pregnant. We've been able to provide, we have specific classes that are geared towards seniors. We have classes that are that we're able to adopt for people living with disabilities. We also serve our English as second language communities. And we work with pantries, faith-based sites, grocery stores, federally qualified health centers, hospitals. There's so many different entities that we work with. Next slide. And so when we talk about the work that we do, there's so many ways in which we can partner. Because I'm pretty sure you're looking at this presentation and saying, okay, now what can we do? Well, we look at strategic community engagement. So we work together to identify areas of opportunity with you. So we look at what is reachable, what are some of the local communities that surround us, and how can we develop some strategies to end hunger within those programs. So if you're part of any, if you have any work groups, task force, planning teams, or coalitions, we welcome you to engage us in the opportunities to be able to sit at the table with you and to be able to really look at how exactly can we join together, because hunger looks different in every county. And we would like to be part of that conversation that's taking place. And we know that hunger, again, is a barrier to academic success with performance, health outcomes. And so the same is true if we improve hunger, so if hunger creates these other effects, if we improve hunger, it can be the catalyst to actually improving conditions, meaning that we'll have more academic success in low income communities. We'll have greater work performances. We'll have greater health outcomes, but we can't do this work by ourselves. This is the reason why we want to be at the table. We want to be able to partner with you. We want to be able to see how exactly can we engage you. And we're looking at engaging all sectors of our communities. One of the things that people don't do is that we actually do work with healthcare systems in order to collectively improve patient outcomes. And we're doing that through not only working with our local health clinics, but we've been able to work with hospitals, where we've been able to partner with farmers markets to be able to actually have farmers markets outside of the hospitals. When patients are coming out, we're providing nutrition education, and we're also being able to engage them and being able to have fresh produce right there when they come out. Not only that, but we're also working through engaging another one of our programs, which is a referral system that's currently in place with the hospitals, where they're identifying food insecure patients, and from that making a referral to our organization, and from that us being able to provide not only nutrition education but engaging that participant in services. And so again, just shows you just the scale and how deep and how interwoven the fabrics are into what we're doing, to be able to help meet the needs in very creative and in a variety of different ways. Next slide. And so one of the partners that we work with in doing this work is Hunger Free New Jersey. We want to bring them up because it's so important to understand that we're one of the hunger fighting agencies, but there's also other hunger fighting agencies throughout the state as well. and Hunger Free New Jersey is one of them. And it worked to help change policies and practice to ensure that every New Jersey resident has healthy food to eat every single day. And so from looking at strategic strategies on a statewide and federal level to advocacy, engaging local grassroots activism, again, it is about creating a comprehensive approach to helping to solve hunger. And we have provided Lisa Pitts, who is the outreach coordinator, and she's amazing. And so she can definitely be of great service to you if you need that as well. And next slide. So it's very important to understand, I mean, we can tell you about all this work that we do, but it's better that you can hear it from one of our partners, someone we've been able to work with for so many years, and they have done such phenomenal work in the community. And we're just so happy to have been able to be a partner alongside with them in doing some of this work. And so I now turn it over to our partner at Jersey City, Stacey Flanagan, who is the director for the Jersey City Department of Health.
Thank you so much, Jessica. Hi there. My name is Stacey Flanagan, and I'm the Director of Health and Human Services for the City of Jersey City. I have a ton of my team on this call because I'm merely representing the great work of the team and speaking on behalf of Mayor Phillip when I talk about how important partnership is to designing a healthier Jersey City. And the Community Food Bank of New Jersey has been an incredible partner for us. And I'm just going to walk through, a little bit about our Division of Food and Nutrition, the connectivity of where we partner with Community Food Bank of New Jersey, and what partnership means to us, and the work that we drove down to at the local level related to how our work became even more important in partnership with the food bank during COVID. So next slide. So this is a very large piece of our Division of Food and Nutrition. There's so many different areas of work that we're doing, and almost every area of work that we're doing, you already heard a little bit about from both Triada and Jessica. We have a healthy food access coordination team, and I think Jose is on the call. So if you have any questions for them, you can always make the connection. And through that, we're doing our work with our farmers markets. We too are helping our farmers glean. We use the farmers market nutrition program, both in WIC and our senior affairs. And they are, moving rapidly to get everyone that qualifies for the program onto the program, so we can really leverage the hundreds of thousands of dollars we have sitting on the table for healthy farm fresh foods. We run Adopt a Lot programming. Our Adopt a Lot program is basically leasing gardens for community gardens across the city, where we expect each garden, in return for the lease with the city, to donate to food programs in need. In addition, these locations are aspiring to support local composting programming. They glean from some of our farmers markets, and in addition, they are engaging in beekeeping and other sustainability programming. We provide food pantry support. So whereas the food bank does the actual banking, and I think Triada really explained this nicely, we're supporting organizations that don't yet have the capacity to be a full-fledged partner of the Community Food Bank of New Jersey. And that means that they just need a little bit more training or increase some of their professionalism. And we've been supporting that for several years through a hunger-free JC movement. In fact, we've inspired 2 nonprofit organizations to form doing this work, and have partnered with us to open 2 food pantries in our city buildings during COVID. So that was really important for us. Some nutrition education support, and we are very lucky, and this is a new project that we're going to be partnering with the Community Food Bank on, and that is the USDA EPA Local Food, Local Places Technical Assistance Provision. And this is nicely timed with some of the stuff Jessica was talking about with education in the food service industry, and hoping to help Jersey City over time become its own community to hire locally and make food locally for many of those food service organizations that are connected to the USDA reimbursable food programs that we work on. In addition to that, we will be distributing locally our own greens through a partnership with Arrow Farm, our Healthy Greens JC project. And that is really building out locations where we can grow our own food and do some nutrition education with our partners from the SNAP Ed program at the Community Food Bank, and continue to provide people with nutrient dense food opportunities, nutrition education, and additional support services to either support their behavioral change or support them along the way to find access to food. We've got some summer meals work. So we are, I'm highlighting all these people that are on the call. So our summer meal supervisor, Morgan Span, is on the call, and she's been doing the program management to provide the 52 locations across Jersey City where we are delivering breakfast and lunch Monday through Friday. She's been working to do site training and management. We do all of the fiscal and grant background to make it so easy for our nonprofit partners, our camps, our recreation and youth development department. And we actually send the team out to do site monitoring. And we're also, managing the vendors every day. And, this was one of those locations where we really, within our system is how do we work closer with the Community Food Bank? And we hope this year to be providing, just in the summer alone, 225,000 meals. And we thought this would be a great way to drive a deeper partnership with the Community Food Bank. But due to COVID, we knew that we really needed to work with an outside provider. And we're working with a wonderful provider out of New York City, and they're doing some really great work with us. Our Healthy Greens JC program was really inspired through a partnership with a local resident who is the founder of Arrow Farms and the mayor, and really with a concept of, feeding people where they live with the most nutrients possible. And the Growing of Arrow Farms is a quick program. In 14 days, we can grow very nutrient dense greens, spinaches, arugula, kale, bok choy, and others. And, we really hope to do not only the build out, which is an extreme project management, but like develop new partners. And obviously the Community Food Bank of New Jersey is a key partner here with our outreach and community education. We've already started some of that outreach and community education with them last month in some of our first locations, which are in the Jersey City Housing Authority complexes, and really supporting these farm sites as we hope to grow 10 farm sites. And that's really going to engage some of our SNAP education and possibly engage more people to sign up for SNAP. And I think you heard Triada earlier talk about, well, we have a significant number of eligible people in the state of New Jersey. Not everybody goes to sign up for these services. So we have an eligibility that is quite large in the city of Jersey City, but we don't have as many people signed up as possible. We also have on the call John Hanasak, and he's our Meals on Wheels supervisor. Our Meals on Wheels tripled throughout our COVID crisis. And in addition to kind of rolling out with some support in the very beginning of COVID, early March 2020, we really relied on the Community Food Bank to get some more food into the communities, because we had to stop serving meals on site, which is our nutrition services program, where we provide congregate meals at locations where seniors congregate, we couldn't do that due to COVID. And so a lot more pressure was leaning in on Meals on Wheels, and the community food bank said, how can we alleviate this? And how can we deliver direct to some of those locations, possibly to some of the Jersey City Housing Authority sites, to some of the other partners across the city, to really help us as we were doing intense intake and assessments. We were, pulling seniors that might need meals that same day, partnering with one of our local hunger fighters, Angela Cares, or partnering with some of our local restaurants with the New Jersey Economic Development Authority funding through Sustain and Serve. Also in a partnership with Logisticare, the Community Food Bank, and via a local service for car service here in Jersey City, we were directly delivering to families' homes that were impacted by COVID from restaurants. And that was individuals that were immigrants that may or may not have the opportunity to get on SNAP programming, families that did not qualify for WIC, in addition to families that may have recently just had COVID or coming out of the hospital with COVID and couldn't go to the supermarket, or were isolated or needed to isolate. And we were just doing those direct deliveries, and, pallets and pallets of food coming in from the community food bank that we were able to move because we had such a great rhythm of partnership. And finally, our WIC coordination. And so we've got Sandra on the call and some of her team, obviously Angela Davis, who, oddly enough, both Angela and I had prior experiences working with a lot of the staff that are currently at the Community Food Bank of New Jersey. And so we also had some, deeper relationships and entrusted partnerships that, are a lot easier to manage in a time of crisis, because we know we could depend on Carlos and Jeannie and Triada because we've had some, deep relationships with them throughout the years. And, in the WIC program, WIC, shut down to see people in person. And instead of losing clientele, we were gaining clientele. But we also had to manage for our own staff coming in, because the WIC federal system really doesn't have a lot of wiggle room. So, our team all had to be in place, but also kind of making the dots connect from that conversation at intake with the health aide to the conversation with the nutritionist, to make sure that, the health aide got that intake to the nutritionist so they can do the nutrition one-on-one, the assessment, get the checks ready. And if somebody was, postpartum and breastfeeding, getting them over to a breastfeeding peer counselor and really making those connections. A lot of the beginning of COVID, a lot of the foods on the WIC food package weren't available in the supermarkets. And, a lot of people weren't really interested in going to the supermarkets. I know that I really stayed away from the supermarkets myself in the very beginning of COVID, and that, sort of the intensity and the breadth of our division of food and nutrition. We have, nearly about 45 staff across this division, and we saw a heightened need, particularly during COVID, to really grow our roots deeper into the community. So next slide. And so our food functions during COVID is really, one, we were really trying to control transmission rates, and we had to implement increased protocols for not only the 2,300 food establishments across our city, but we had to really talk to people every day about food distribution. And some people might see that we post food pantries and who's open, who's not open. We started finding many food pantries couldn't engage the same number of volunteers that they had in the past. Many of our food pantries couldn't get the food donations that they were getting outside of the community food bank. And in addition, we saw a lot of pop-up food distribution locations and we didn't know where their food was coming from. And so from a food safety perspective, we really established some, safe maximum capacities for not only the stores and how the shoppers were coming into supermarkets and keeping that social distancing, which was really important, but also for, overnight food distribution avenues. And so we created a food distribution protocol and sent that out to all of our nonprofits across the city. And as we started engaging with them, and really this was an entree for them to better understand what it takes to become a member agency of the Community Food Bank of New Jersey, or Table to Table, one of our other partners that helps with food rescue. We managed to see about an increase of 250% in our Meals on Wheels clients, but about a 240 increase in the meals delivered. And that's because sometimes we deliver 7 meals to a client per week, and sometimes we deliver only 5 meals per client per week. So we, raised our number to about 1,405 clients, serving just under 9,000 meals a week. And we increased our participation in the WIC program about 20%. And similar to what both Jessica and Triada are talking about, we really looked at our farm economy and what was going on in our farm economy during this time. Farmers were only coming to Jersey City between the spring and summer, maybe early into fall. So we extended the farmers market season to be a year-round market, because we knew that some of our farmers weren't able to move their food as rapidly as well. And so we focused solely on the farmer for the first year, and we've just recently opened up to other vendors to really fill out the market space. Last season, we provided each farmer's market in our community additional dollars as we were trying to engage our farmers market nutrition program participants to visit the farmers markets for their produce, because a lot of seniors were scared to leave their home. We have nearly $100,000 in farmers market nutrition program checks just in our senior community, but they didn't really want to leave their homes, and so this became a way for us to engage in ways to how do we host a pop-up farmers market as we're doing COVID testing in one of our locations that only accepts farmers market nutrition program checks to help the farmer move down that pathway. And then we developed, and we really couldn't have done this without the support of the Community Food Bank, was developed and launched a delivery program for emergency food assistance. And throughout COVID, we served nearly 550 families who would otherwise not be eligible for either SNAP or Medicare, Medicaid, and other support services. Really nearly 200,000 meals we provided through various programs. And we really were, I will say, on the forefront of this with the help of the Community Food Bank, kind of logistically speaking, getting food delivered to us here, right here at our City Hall Annex. And from this location, having drivers set and ready to go to deliver to each ward in our community to ensure that people were getting the food that was necessary. In addition to that, we understood that our seniors had very different meal needs. And so we worked with the Community Food Bank on frozen food drop-off locations in some of our housing authority sites, but in addition with some of our partners, groceries to seniors so that they could get immediately some things that they know and they need to make sure that there was food in their community. And so next slide. And so just showing, like the central idea of like the Community Food Bank to our food pantries in Jersey City. We're such at the forefront for our Aero Farms, our Healthier Greens JC program, where we're going to be leveraging SNAP Ed for the USDA food boxes and the deliveries that we got supported through the Community Food Bank. And then our Healthy Corner stores that we received a lot of SNAP Ed support to engage in that work in our community to help our local bodega economy. And so just wanted to share sort of the reasons behind partnership. And without the mayor's wellness campaign, and I will tell you, from the day I started here in 2013, it may have been this week, 2013, was the first email from the mayor's wellness campaign to Mayor Fulop asking him to join. And he has been a member, for the last 8 years. He has shared his, healthy green smoothie favorite to the recipe book. He has spoken at several conferences. I've also spoken on his behalf at the league of some of the work we've been able to do, because the mayor's wellness campaign really allows us to look at other cities and who they've partnered with, shared with us, what entrusted partnership means, show us, new ways to do this work, and not, just on food. I mean, I will highlight, someone also on the call, Joan Eccleston, that has been working not just in food for seniors, but all senior affairs, and our conversation of a lifetime, which started nearly 7 years ago with the mayor's wellness campaign, has become, a large program of a conversation with our seniors about their needs, and conversations that we have to help them have with their children that wouldn't exist without the mayor's wellness campaign. And so that the mayor's wellness campaign is highlighting hunger and the need at the local level to support food insecurity, which we know has just been on the rise since COVID, more exacerbated because of job loss and lack of affordability of food costs increasing, et cetera. We really honor these partners that we're here at the table with today. So I will wrap that up quickly. I think I speak pretty fast, and if there are any questions, I think just some highlights of local food distributions, and the USDA food boxes that just runneth over to get food to people in our community. So
Okay, thank you all so much. I know that we're over time. We do have one question, so if folks on the line need to jump off, completely understand, but if you want to stick around, we'll just talk about the one question we have, and if anybody else has any others, feel free to type those into the chat. We did have some that were addressed via chat, but for Stacy, are the Jersey City farmers markets enrolled in City Green's Good Food Bucks program? And if so, has this helped to get SNAP benefit users to the market?
We worked with City Green several years ago as a partner for the Wholesome Wave Double Bucks program. And we have just shared with our markets again the City Green's Good Food Bucks program. I would have to get back to everyone on how many are enrolled now, but we do know at least one of our markets has been doing double bucks since, I'm going to say 2015. And we had several in a previous City Greens program that coordinated with Jersey City, but the current City Greens program, I'd have to follow up, as some of our farmers markets don't see the benefit until July, when FMMP is live, and then they see more people coming to the markets.
Great, thanks. Any other questions before we sign off? Okay, not seeing any. I just want to thank all of our presenters today. I think we've heard so many great examples of how partnership can really result in getting residents the services that they need. And I love, all of the programs that the Community Food Bank is offering. And I think a lot of towns will be able to see how they could benefit from partnering with the food bank. My contact information is up on the screen there. If you do have any questions, I can certainly get those to the speakers. As I mentioned earlier, this presentation was recorded, and we will have the recording up on the website by the end of the day tomorrow at the latest, if you need to see that. And if you have any questions, just feel free to contact me. Thank you again for joining us, and have a great rest of your day.